Next speaker is effects of carbon dioxide pneumoperitoneum on renal function and obstructive jaundice, an experimental study in a rat model. This is by the group from Ankara. It's going to be presented by Mustafa Sare.
The authors have nothing to disclose relative to the present work. Laparoscopic apparatus are being applied in all areas of surgery with an increasing frequency. Different effects of pneumoperitoneum and obstructive jaundice on many organ systems has been reported. Both pneumoperitoneum and obstructive jaundice impair the renal function, but the combined insult has not been previously examined. In this study, we aimed to investigate the effect of carbon dioxide pneumoperitoneum on renal function in a rat model of obstructive jaundice with new biomarkers, NGAL and cystatin C. Cystatin C is a low molecular weight protein that is a member of the family of the cysteine proteinase inhibitor. Cystatin C is freely filtered by the glomerulus. It is not secreted but is reabsorbed by tubular epithelial cells and subsequently catabolized so that it does not return to the blood flow. Because of these properties, cystatin C bears some advantages over serum creatinine. Cystatin C and creatinine is compared in meta-analysis, including 46 studies. In this meta-analysis, serum cystatin C is clearly superior to serum creatinine as a marker of glomerular filtration rate. Today, the clinical use of cystatin C is detecting early renal impairment in diabetic and hypertensive nephropathy. Several clinical studies and applications of cystatin C developing kidney failure before and during chemotherapy treatment and nephrotoxic drug treatment monitoring in acute and chronic kidney failure, monitoring kidney functions. NGAL is a member of lipocolin family. Several biochemical functions are defined, such as stimulation of the apoptosis, regulation of inflammatory response, suppression of bacterial growth. Mainly, an increase in NGAL expression is within inflammatory and epithelial damage. Recent studies vived an early increase of NGAL values of both urine and blood analysis after nephrotoxic or ischemic impairment of kidneys. Material and methods. 48 male rats were divided into 8 groups, including 6 rats in each group. Group 1 sham-operated group, Group 2, 3, and 4, 5, 10, and 15 mm Hg carbon dioxide pneumoperitoneum was induced respectively. Group 5 obstructive jaundice group, Group 6, 7, and 8 obstructive jaundice with 5, 10, and 15 mm pneumoperitoneum was induced respectively. Carbon dioxide pneumoperitoneum was provided by varus needle maintained for 60 minutes. Common bile duct was ligated and divided in the obstructive jaundice group. After 48 hours, a 5, 10, 15 mm Hg pneumoperitoneum was induced by minimally-invasive with a varus needle in group 6, 7, and 8, maintained for 60 minutes. Blood samples were drawn for the measurements of standard biochemical accounts, cystatin C and NGAL for assessment of renal function. The data were analyzed by statistical software. All animals tolerated the surgical procedures. There were no statistically significant differences between the all groups with regard to standard biochemical accounts for renal function, included blood, urine, nitrogen, and creatinine. Furthermore, NGL values are high in obstructive jaundice groups, and there were statistically significant differences between other groups. Sorry. The obstructive jaundice with 10 and 15 mm pneumoperitoneum group statin C values are high comparison with the same procedure of only pneumoperitoneum group. There was statistically significant difference between these groups. In group 6, 7 and 8, NGL values, higher comparison with group 5. The differences between these groups were statistically significant. There were no statistically significant difference in NGL values between groups 6, 7, and 8. There were no statistically significant differences of statin C level comparison between the group 1 and 5 and 2 and 6. The differences between these groups were, sorry about that. Statin C levels are higher in groups 7 and 8 comparison with group 3 and 4. There were statistically significant differences among these groups. Conventional renal function tests were normal, while NGL and statin C was found to be effective in showing an early stage of renal injury. Renal injury became more apparent with obstructive jaundice, potentiated by the pneumoperitoneum. Consideration and appropriate measures should be taken for the development of renal injury in patients with obstructive jaundice during pneumoperitoneum. Thank you for your attention.
Any questions from the floor? I have one question about your model in the rats. A pneumoperitoneum of 15 millimeters is pretty high for a rat model. I think more typical, it's considered 5 to 8 millimeters is equivalent to human pneumoperitoneum. Do you have any thoughts about this?
That's true, but our previous study, we used the same model. Mm-hmm. Maybe sometimes use the high pneumoperitoneum in the operation. Mm-hmm. I tried that the high pneumoperitoneum is affected the different low, such as 5 and 8 or 10 millimeter pneumoperitoneum.
Have you looked in clinical cases then and used your markers in clinical cases to see if this is true in typical surgeries in obstructive jaundice in humans?
No, we have not. Maybe we will try it. Maybe there is we will plan another study on the pneumoperitoneum, longer pneumoperitoneum, such as 1, 2, 3, or 5 hours pneumoperitoneum effect on the renal function. We will study that.
Mm-hmm. Yeah, very nice study. Thank you.
Thank you very much, sir.